Special tests. The physician will start by testing the deltoid ligament, also called the medial collateral ligament stress test. 1. Was the patient placed in supine position? Stabilize around the calcaneum with one hand and the medial forefoot with the other hand. Move the calcaneus away from the midline and simultaneously avert the forefoot in slight dorsiflexion. 3. Positive test is indicated by pain or laxity from the medial side of the ankle. The next step would be to examine the lateral ligaments, which are the anterior talofibular ligament, the posterior talofibular ligament, as well as the calcaneofibular ligament. 1. With the patient still in supine position, localize and palpate the three structures to see if there is any tenderness or crepitus. 2a. The anterior drawer sign is used for the ATFL. With the foot in a relaxed position, draw the foot in anterior position while holding down the lower leg. You should feel a firm end point, and if there is any laxity, you should compare it to the other side to see whether there is a difference. B. The CFL can be tested using a forced inversion and again assess side to side. The doctor will have to assess the talar dome for any osteochondral defects and palpate the base of the metatarsal for a fracture there. 1. Localize the talar dome with the lateral malleolus working his way anteriorly to the recess, and then localize the anterior drawer line where the talar dome will sit under. The patient should report tenderness if there is any pathology there. 2. I should also palpate the base of the fifth metatarsal to see whether there is an associated fracture there. The doctor should be worried about the fascia that runs between the tibia and the fibula, known as the syndesmosis. This can be tested by two tests. The dorsiflexion external rotation test. Patient in a seated position with his knees hanging from the table at 90 degrees. Bring the patient talocrural joint into maximum dorsiflexion and apply an external rotation stress to injured foot and ankle. This test is positive if the patient's anterior lateral pain over the syndesmosis is reproduced. The syndesmosis squeeze test. 1. Have your patient in supine, lying position and squeeze the fibula and tibia together. 2. Apply the same compression to more distal places down the malleoli. The more proximal the pain is felt, the more severe the injury. The tunnel test to assess a tarsal tunnel syndrome, which is caused by impingement of the posterior tibial nerve. Patients would complain of paresthesia, radiating to the great toe and sometimes the first three toes. The tunnel sign can be elicited in two places around the ankle. A. First in the anterior tibial branch, assessed by tapping anterior to the medial malleolus. B. Secondly, you may be able to elicit the tunnel sign for the posterior tibial nerve by tapping behind the medial malleolus. The calf squeeze test, a highly sensitive tool to detect an Achilles tendon rupture. 1. Have your patient in prone position and the feet should hang freely off the edge of the bed. 2. Squeeze the calf a couple of times and you should be able to observe plantar flexion at the ankle joint. If it is absent, this indicates an Achilles tendon rupture.